Okay. We're going to continue on with the ear. Okay. The tragus is movable, and we're going to look inside. Okay. And then we're going to do some tests concerning your hearing. Okay. And everything I do with what I did with the eye, when I take the eye and with the ear, would be done bilaterally. Okay, you pull the pinna of the ear up, back, and out. The external meatus looks good. The ear canal is of normal size. It is clean. There's mild waxy, small amount of waxy yellow cerumen noted. The tympanic membrane is intact with no lesions. It is a flat, translucent gray. The umbo, pars flaccida, pars tensa, and malleus are noted. The cone of light reflex is noted here in the right ear at 5 o'clock. It would be at 7 o'clock in the left ear. Okay, so now we're going to do some tests concerning your hearing. What I'm going to do is I'm going to stand over here. I want you to close your eyes. I'm going to whisper something, and I want you to repeat what you hear, okay? I'm going to do that on each side. So if you'll close your eyes for me. This assesses, the whisper test assesses high frequency hearing. Okay. Can you repeat that?
Today, Thursday.
Okay. I'm going to go to the other side. Okay. Can you repeat that?
I like ice cream.
Okay. I think everybody does. All right. You can open your eyes. All right. We're going to use the tuning fork and do some hearing tests with that. The Weber test, I'm going to place it Do you hear that equally in both ears?
No.
Okay, which ear do you hear it louder in? Hear it louder in your left ear. Okay, that is lateralization. You should be hearing it equal in both ears. We may need to get you to an ear specialist. Okay, the Rene test is going to assess air conduction versus bone conduction. I want you to tell me when you stop hearing the noise. Okay? And then I'm going to move it out here beside your ear and you tell me when you stop hearing the noise. Okay? Okay, and that shows that air conduction is 2 times as long, or is in a ratio of 2 to 1 with bone conduction, which is normal. Okay, we're going to look now at your nose and your mouth. Okay, the nose is midline. There's no evidence of trauma, no lumps or bumps. Palpating, I feel no bulges. Okay, my little light go. There's my little light. If you just tilt your head up for me. The nares are even. The septum shows no signs of trauma. It is not deviated nor perforated. The inferior turbinate is visible. The superior turbinate is not visible, but I see no signs of trauma. I see no foreign bodies, no blood. There's no excessive redness. Okay, all right. We're going to assess your sense of smell, your olfactory nerve, which is the first cranial nerve. First, we're going to get you to make sure you can take a good deep breath through each nostril. All right, take a good deep breath for me. Okay, that nostril is patent. Okay, again. Okay. Now, I'm going to let you smell a couple of things and close your eyes for me and tell me what you smell. It's going to be familiar. Okay. Take a whiff. Can you tell me what that is?
Vinegar.
Okay, that's correct. Okay. Okay, now we're going to do the other side and do another scent. Okay, will you tell me what you think that is? Take a big whiff. What do you think that is?
Cinnamon.
Oh, that's very good. That is cinnamon. Okay. Makes you think of apple pie. Alright. Okay, we're going to look at your mouth now. You can open your eyes. Okay. I'm going to put some gloves on since I'm going to be playing around in your mouth a little bit. Let me see your teeth. Do like this. That's checking for occlusion, that your teeth match and meet up, and they do. Okay. The lips, you just feel them. The lips are pink. They are moist. There's no lesions noted. There is facial hair noted around the lips and on the chin. That is normal. Okay. Go open your mouth for me. There we go. I see some fillings, but the teeth are in good shape. They're clean. Right. The gums are firm. There's no bleeding. No receding noted. Okay. Stick your tongue out for me. The tongue has smooth lateral borders, smooth edges. There's papilla noted on the top, on the dorsal side. Lift your tongue up. Let me look at the underside. The underside is well vasculated. The sublingual frenulum is intact. Okay, relax for me. Inferior and superior frenulums are intact. Wharton's duct is intact and producing saliva. No calcifications are noted. Stenson's duct is intact, working. No calcifications noted there. The buccal mucosa looks good. There's no excessive redness. I see no lesions, anything like that. The hard palate is rugged. It continues with the soft palate. Okay, just normal. Open your mouth and say ah for me. Okay. The palate lifts when he says ah, and the uvula is midline when he says ah. Okay. All right. Very good. Now we're going to look at your neck. Okay. The neck muscles are firm. The neck is midline. Trachea is midline. Okay. I'm going to palpate your trachea. Will you swallow for me? Okay. Now tilt your head back and swallow. Okay. There's no deviation in the trachea. The tracheal cartilage is easily felt as you move upward. The outer horns of the hyoid bone are easily felt. Okay, very good. Thank you. And the vertebral prominence, which is C7, cervical vertebrae 7, is felt without any problems. The paravertebral muscles are felt with no problem. They feel firm and intact, in good shape. Okay. Just look normal, and everybody calls it an Adam's apple, but I'm going to watch that move, okay? We're assessing the thyroid. All right, if you'll swallow. Okay, the thyroid is seen as moving up and down. I'm going to get behind you and poke around on your neck from behind. If you'll tilt your head down and to the right just a little bit, okay? You go between the trachea and the sternocleidomastoid muscle. Okay, can you swallow for me? Okay. It is not felt, but that is normal. Okay, I'm going to listen to your thyroid. Okay, I don't hear any rushing of blood, which could indicate hyperthyroidism. While I'm here, I'm looking at the carotid arteries. I see normal pulsations. If you would tilt your head, the jugular veins are not distended. You would check this bilaterally. Okay. Carotid arteries are checked one at a time when they are palpated, and they feel normal. And I'm going to listen to those while we're already up here in this area. There are no bruits noted. The temporal arteries are felt evenly on both sides. I'm going to auscultate those. There's no bruits noted there. Combining a couple of categories here, might as well do everything from the top to the bottom, don't you think? Okay. I'm going to check your lymph nodes, okay? We're going to start with the preauricular, the postauricular, the submental, sublingual, submandibular, the anterior cervical chain, and the posterior cervical chain, the occipital. Okay, if you'll kind of shrug your shoulders up for me and down for me. And that assesses the supraclavicular. And none of those are swollen. I don't notice any bulges or anything. And you're not supposed to be able to feel. Okay. We're going to, if you don't mind, if you'll come sit over here. I'm going to swap around and move some of my stuff around. Okay, if you'll just have a seat right here. I need those things. Those things. I need that. Okay. The chest wall is it is symmetric. I do not see barrel chest, pigeon chest, or kyphosis. Okay. When I palpate, I do not feel any lumps, bulges, or masses. Okay. If you'll turn to the side just a little bit for me. Alright. Now, I want you to say, I'm going to put my hands on you, I want you to say 99 over and over. Okay? Repeat that for me.
99.
Again.
99. 99.
Okay. No crepitus, no is noted. That is tactile fremitus. It is greater in the apices than the bases, which is normal. Okay, if you'll turn this way. Oh, wait, sorry, one more time. I'm sorry. All right, let me turn you way around here. Okay, I want you to take a good deep breath for me. All right, thoracic expansion is even. Okay, you can let it out. There you go. Thoracic expansion is even. Okay. I'm going to tap around on your chest. Okay. Resonance is normal. You would go from side to side. And, you know, apices to base. We're going to look for the diaphragmatic excursion. If you'll lean forward with your arms across your chest right quick for me. All right. Take a deep breath and hold it. You go from tympany to dullness and mark. All right. Now I want you to blow out and hold it. Ready? Blow out and hold it. Okay. And you're going to go from resonance to dullness. Right there. And mark. You're going to measure that. Normal is 3 to 5 centimeters. And we have 3 centimeters. Okay. All right. We're going to move on to part 3 now.